Hi. Did you know? This quote idea is by an American physician named Edward Treadell. He is the founder of the famed tuberculosis sanitarium at Saranac Lake in New York. He had used both rest cure and a salutary environment to treat his patients. The theory idea came from Hippocrates, the famous Greek physician. He wanted a cautious and empirical physician who is aware of the limits of his knowledge and understand patient's condition. Other words, doctors might not have the cure, but it is their responsibility to provide the best care and provide mental and physical support. Full of empathy and sympathy.
This is Mrs. Connie Lambert. She is 76 years old and has retired. It's been a few days. Mrs. Lambert's cough has not healed. She has heard an advertisement about COVID-19 symptoms. She was very surprised because she has experienced the symptoms.
Mrs. Lambert decided to go to a hospital. According to her symptoms, the doctor advised her to take a COVID-19 swab test and undergo a quarantine while waiting for the result. Mrs. Lambert has her autonomy as a patient either to proceed with the treatment or not. Patient autonomy is the right of patients to make decisions about their medical care without their healthcare provider trying to influence the decision. Mrs. Lambert continues to undergo her quarantine at home while waiting for her COVID-19 result. On her third-day quarantine, Mrs. Lambert was confirmed positive with the COVID-19. She was admitted to the hospital and received some treatment such as oxygen mask, nasal cannula and medicines. Healthcare workers have done their best to treat the patient accordingly to the principle of beneficence. Due to pandemic breakdown, Mrs. Lambert's family could not visit her. So doctor there decided to make a video call to her family. After that video call, Mrs. Lambert looked so happy. And she looks more enthusiastic. This also helped Mrs. Lambert to keep fighting the coronavirus until she recovered. Being a doctor is not only about treating patients, but we also need to comfort them. Sometimes we see our patients look happy, but the reality is they have a lot on their plate. That is why we as doctors need to be their supporters and try our best to help them. What is equity and justice? Equity refers to fairness, where there is an even-handed treatment for all people, while justice refers to the quality of being righteous and fair in every single aspect. It is very important in medical field, and we should always imply it in our future as a doctor.
Based on the case of Mrs. Connie Lambert, which is a foreigner, what should we do as a professional medical practitioner if the beds for patients are limited?
Here's the story continues.
What if Mrs. Connie Lambert is actually traveling? The medical officer should know that everyone has the right to receiving medical treatment. Even if the bed is limited, hospital management should protect the patient's right by not chasing away Mrs. Connie Lambert. They need to apply the concept of equity regardless the nationality of the patient and provide the best treatment for her.
As a doctor, it is essential to be sensitive towards the patient's mental health, as it plays an imperial role in the healing process. And also, any information addresses to the patient must be precise, accessible and easy to understand. Moreover, maintain the solidarity and give equal treatment to all patients. Thank you.